Training people in such things as mental health first aid and psychological first aid can save lives also. My name is Julius Brown, and I am the director of OSI-CAN. I'm also a veteran of the military.
My name is Ron Lee Arnold. I am the communications coordinator for OSI-CAN with the Canadian Mental Health Association Saskatchewan Division.
OSI-CAN is a program of the Canadian Mental Health Association Saskatchewan Division, created in 2016 and launched through a joint partnership with the Royal Canadian Legion Saskatchewan Command. Our mission is to provide mental health support to veterans and all frontline protectors and their families. Our target demographic is actually quite broad. It includes currently serving and former members of the military, RCMP, frontline protectors such as municipal police services, emergency medical services, fire protection services, emergency dispatch and crisis operators, indigenous emergency management, traumatic accident cleanup crews, conservation officers, CN police, and the list goes on.
Well, additionally, I was a correctional officer for 10 years, and what I had done was ended up with PTSD, diagnosed in my case, and I was looking for a group that I could actually discuss things that I couldn't discuss at home. And so I was searching around and was about ready to start a group of my own when I heard about OSI-CAN through a firefighters organization. And so I ended up finding the group and talking with the person who started OSI-CAN up, and now I am working directly for that organization that provided me a service dog.
We all need a safe place where we can have open discussions about mental health. And I feel our mission is to remove the barriers to getting help. We provide peer support, lived experience peer support. That's the core of our program. And we do this by having peer support groups located in the different communities across the province where our target demographic lives. Because of that, we now have 14 support groups throughout the province. And this also includes support groups for family and close friends. We have a list of counselors that specialize in trauma, anxiety, and depression. And we also provide financial assistance for those who don't have it to see counselors. Another program that we have is a service dog program where we provide the financial assistance for the acquisition of service dogs. One of the greatest strengths to our model is that no formal diagnosis or referral is required.
The community can make a much bigger impact by doing things like helping to fund organizations like OSI-CAN. They can also get a hold of different organizations like us when they meet someone who has trouble. Like for instance, in my line of work as a corrections officer, I was often told, well, maybe it's time to go and time to find another career. When if they had said, hey, maybe we can get you some support and get some help, I might not have had to leave that career. I might have been able to basically rebound and be able to get back to a regular life outside of the work and a safer and more healthy mentally work within the jail.
Challenges like stigma can be resolved through education and experience. That's one of the challenges that we face. But just as training people in medical first aid for physical health has saved lives, training people in such things as mental health first aid and psychological first aid can save lives also. Government funding is certainly required with programs such as ours. Currently, we're being funded solely through private donations, and more support for the volunteer firefighters, who don't qualify for programs or receive limited support, I should say, for mental health.